Good afternoon.
Good afternoon, thank you. Appreciate the opportunity to be here. Respected members of the Joint Standing Committee on Appropriations, Financial Affairs, Health and Human Services. My name is Nell Meltzer and I'm the Executive Director of WABAN, testifying in support of early intervention services and in opposition to the 10% cuts from Sections 28 and Section 65. I'm speaking today for both WABAN and MAXB. WABAN is a nonprofit organization in southern Maine that has been providing services to children and adults with developmental and other intellectual disabilities and autism for over 45 years. Over the course of 1 year, we will provide a comprehensive array of services to over 3,000 children and adults with special needs. MAXB is an association of organizations that provide supports and services to the same population and has approximately 70 members operating throughout Maine. It is beyond dispute that for children with special needs, investing in focused interventions during the first 5 years of life, when their lifelong learning and skill-building capacity are in the most critical formative period, is essential. According to the Center for Disease Control, 29%, or over 20,000 of Maine's children under 5 years old, have a learning, behavioral, physical, developmental, or other disability. Over the past 12 years, the prevalence of developmental disabilities has increased over 17%. The prevalence of autism during that same period of time has increased over 289%. 1 in 68 children have a diagnosis of autism. 1 of every 42 boys and 1 of every 189 women or girls have autism. Numerous studies have outlined the financial benefits associated with early intervention services. Special education costs during the K through 12 years can decrease over $15,000 per child that participates in the early intervention services. Maine special education spending can be reduced $89 million per year. And there is a $13 return for every $1 invested in early intervention. It is abundantly clear that specialized early intervention for children in this age group is essential. WABAN's comprehensive early childhood program includes early intervention and special purpose preschool classrooms. The two major funding sources for these services are Maine Care Section 28 and Section 65, Children's Behavioral Health Day Treatment. Since 2010, we've been working with HHS to address the faulty implementation of Section 28. In January of 2014, HHS agreed to go through a comprehensive cost analysis and rate review process for that section. It is a bit confusing and difficult to understand why a 10% across-the-board reduction in Section 28 rates is being proposed without the benefit of being able to see and review any of the rationale and findings from that comprehensive rate review process. Similarly, for Section 65, without being able to review how the type, range, breadth of services, and expense drivers compare from state to state, or the full analysis that HHS has done, it seems premature to have a 10% across-the-board reduction. Let me say I commend the Governor's and Commissioner Mayhew's efforts to provide in an ongoing way $24 million in general fund and $42 million in federal sources to fund Maine's wait list for adult disability services. Based on the increase in prevalence of disabilities in children under 5 years old, and the incontrovertible proof of the success and cost savings associated with early intervention services, such as those provided in Sections 28 and 65, wouldn't it make sense to reduce the future need and ongoing cost for adult services by ensuring proper funding for early intervention? Consequently, I have to question the reasoning behind and the value of reducing Sections 28 and 65 rates and the subsequent impact of these critically needed early intervention services. I would respectfully request that you do the same.
Questions? Thank you.
Thank you.
Kara from Penquist.
Happy Friday afternoon.
Good afternoon to you.
Senator Hamper, Representative Rotundo, Senator Brakey, Representative Gatine, and members of the Joint Standing Committees on Appropriations and Financial Affairs and Health and Human Services. My name is Kara Hay, and I'm the Chief Executive Officer of Penquist, which is the community action agency that serves Penobscot, Piscataquis, and Knox counties. I also serve as a board member on the Maine Community Action Association, which is comprised of Maine's 10 community action programs, CAPS. The CAPS mission is to eliminate and alleviate the causes and conditions of poverty by assisting low-income individuals to move towards self-sufficiency. Each year, we serve 200,000 residents of Maine, providing a variety of services, including, among others, Head Start and childcare. I'm pleased to be here today to discuss children's services with you. I've seen firsthand the challenges faced by many low-income parents and their children, and how the right assistance can help them overcome those challenges. Penquist and MCAA believe that Maine should have a comprehensive early care and education system that incorporates 4 essential components: Maine Families Home Visiting, Head Start, Pre-K, and the Child Care Development Block Grant, CCDBG. Quality early care and education provide long-term benefits to the children being served and to the larger community. Studies indicate a return of ranging from 7-to-1 to 9-to-1 on public investments in such programs. Unfortunately, Maine Families Home Visiting, which provides home visits for pregnant women and new mothers, just learned last week that a federal grant will not be forthcoming. That's an $8 million a year loss and a 75% reduction in overall funding. Maine Families Home Visiting has been shown to prevent, identify, and address child abuse and neglect, and to identify and address domestic violence. Penquist operates a Maine Families program, and I have personally seen its benefits. We were shocked that Maine did not receive the continued grant. Maine Families provides quality services with consistently strong reviews. Unfortunately, the latest round of grant requests did not consider Maine's strong track record. Maine received a score of 91 of 100, but only scores 92 and above were funded. Last year, Maine Families employed over 140 people, including 12 at Penquist, and provided over 22,000 home visits to more than 2,400 families. These important and vital services are at risk. Historically, Maine Families received significantly more state funding. In 2012, when the federal grant was first received, state funding was cut by $5 million a year. We're asking that state funding be restored to help preserve this essential effort, and legislation to that effect is anticipated later this year. Head Start assists low-income children and their families. Research shows that these intensive supports for children and their families make a lasting impact with improved school readiness, increased educational achievement, improved child health, reduced chances a child will turn to crime, and improved parenting skills and practices. Head Start is flat funded at current levels in the budget. We sincerely appreciate that support and urge that at a minimum, it remain at those levels. Please note that today, only 30% of eligible Maine children are receiving Head Start or Early Head Start services. There will be proposals later this year to serve additional children. The Child Care Development Block Grant, CCDBG, assists low-income parents with child care vouchers that allow them to enter or remain in the workforce. It also helps connect parents with child care and helps support quality child care programs. It's only partially funded in the budget before you. Maine currently fails to fully draw down available CCDBG funds. An additional $2 million will allow Maine to draw down $3 million in federal funds. As recently as 2012, Maine was fully drawing down federal child care funds. The most important part of the block grant is the vouchers that go to low-income parents to allow them to work. Providing such vouchers is one of the best steps we can take to help families get into the workforce and off assistance programs. Legislation, sponsored by Representative Fry, will be forthcoming later this year to address this shortfall. Finally, last year, the legislature set aside $4 million a year to fund expanded pre-Ks in Maine. Ultimately, pre-K should be available to every interested family and child. Unfortunately, the budget eliminates that $4 million. This will be discussed further at your hearing on Monday, but I wanted today to register both Penquist and MCAA's objection to this change. Thank you very much for your time, and I'd be happy to answer any questions.
Representative Gattini.
Thank you, Carol. This issue about the main families grant that we didn't get, maybe we were re-up for, it's come up a couple times this week. One of the questions, it's main families my question is, can we ask whoever scored that grant to reconsider that scoring or somehow appeal it? And again, is that the department applied for that grant? Is that a question directly to the department, or?
I have just the person to answer that question, Cheryl Peavy.
Yeah, well, maybe Cheryl, for the work session, if you give us that information, I know that sometimes those opportunities are there, and it's obviously, I'm sure, very frustrating to you and frustrating to everybody involved that, it was so close, and if we could understand what the scoring was, and if there's an opportunity for us to ask those people to take another look, that would obviously be something we'd all be interested
I
in.
will provide that information.
Thank you.
Representative Green.
Thank you, Mr. Chair. Thank you for your testimony. Ms. Hay, can either you or somebody else out there for the work session provide for us the number of families? You mentioned in the Head Start category that only 30% of eligible children are receiving those services. So that suggests that there is maybe not necessarily a waiting list, but 70% of the families who would be income eligible to participate in Head Start are not able to. Can you give us an idea of how many families or children that represents, either now or for the work session?
Certainly, we could get that for you for the work session. And just to add, we do have wait lists for all of the Head Start programs as well, but we can get that specific.
Can you get those numbers to us?
Absolutely.
Thank you.
Representative Jorgensen.
Thank you, Mr. Chair. Thank you, Kara. Just very quickly. So this grant that didn't come through, which I'm very sorry to hear about, that started in 2012. And prior to that time, I think home visitation has been going for a long time. How was that funded before that?
Sharon,
Yeah.
Previously, that funding came through the,
would you be willing to identify yourself?
I'm sorry, Cheryl Peavy with the Department of Health and Human Services. That funding previously was in the Fund for Healthy Nation for several years. It was also supported by the Maternal and Child Health Block Grant Match, as well as the Maternal and Child Health Block Grant dollars 10 years ago.
I see. Thank you very much.
So from the course here? Good, thank you.
Did Ken Olson come in?
I'll keep calling until he's back. Jeffrey Johnson.
Senator Hamper, Representative Rotundo, members of the Joint Standing Committee on Appropriations and Financial Affairs, Senator Brakey, Representative Gattine, members of the Joint Standing Committee of Health and Human Services. My name is Jeff Johnson. I'm the Executive Director of the Children's Center, testifying in opposition to the cuts being proposed in LD 576, cutting 10% from Section 28 and Section 65. I am speaking both on behalf of the Children's Center and also the Maine Association for Community Service Providers, MACSP. As some of you might know, the Children's Center is a nonprofit organization. Our main center is a couple of minutes down the street here. We provide, on any given day, services to about 300 children, both in our center here and our center in Skowhegan. About 90% of the children that we provide services to in our centers have some type of disability, the majority of which meet the criteria for both Section 28 and Section 65 services. And of the children that we provide services to, about 85% of those children come from low-income families. MACSP is an association of organizations that provide supports and services to children and adults with developmental and other intellectual disabilities and autism. We work with many offices and departments of state government to deliver high-quality services to Maine people. MACSP has approximately 70 members operating in all 16 counties of Maine. I was here yesterday and heard testimony about Section 65 and 28 cuts and a lot of systems discussion about what that would do. And what I'd like to do is just tell you about a small part of that system, and that's the Children's Center, which is a small organization. We're about a $3 million budget, and also a particular small community that we provide those services to. I can tell you at the moment, without these cuts to Section 28, the Children's Center operates at a loss in our Section 28 services delivery. Many of the children which we provide these services, primarily in Somerset and Kennebec counties, they live in rural areas. And the in-home services that we provide that are part of the 28 service delivery system it's based, as you know, on face-to-face services. And for us, many of those services are providing interventions to young children, 2 to 6 years old, diagnosed with autism. What some of you may not know is that the Department of Education here in the state of Maine has endorsed a particular type of applied behavioral analysis intervention for young children with autism based on research that was done both at the University of Colorado and University of California. And our organization, the Children's Center, provides that intervention. It's also, that particular intervention is also a main care covered service. Some of the research, one study in particular, cites that if this intervention happens for a 2-year period between the ages of 2 and 5, that 40% of the children that participated in that study, at the end of that 2-year intervention, by their 5th birthday, that they fell off the autism spectrum criteria, meaning 40% of those children that had that early start intervention to autism, at the end of that 2-year intervention, they no longer met the criteria to be diagnosed with autism. And you've heard yesterday and you've heard some today about how early intervention, depending on what studies you're looking at, pays for itself either 7-to-1 or 14-to-1 dollar-to-dollar ratio. About 3 months ago, the Children's Center decided to cut back on our 28 in-home support services. And we had to do that because we were losing money. We continue to lose money on our delivery of 28 services. But we had to cut back because we provide these services in rural Maine communities. And the nature of this service, as you know, is that face-to-face intervention. So if we have a child with autism, a 3-year-old in Norwich Walk, and then we have a 2-year-old in Kingfield, and another 4-year-old with autism that's in Starks, that is more than a full day work for one person, and the only time that they can get reimbursed for the services that they're providing is the time that they are in direct face-to-face interaction with the child. And so, in my view, and I think others, a 10% cut to 28 and 65, but specifically to 28 around children with autism, I can tell you, we would not be able to provide those services to children in rural areas. It simply wouldn't happen. And so there is an equation here, in that areas that have a larger population, organizations that are providing those 28 services, financially would have an easier time than those organizations like us that are going out, and there are other organizations certainly that do it around Maine. So you can sort of extrapolate this, example to other communities that are small, like Skowhegan and surrounding towns. They're going to struggle and not be able to provide that service. So my hope is that just from a business standpoint and an investment standpoint, that these cuts don't happen. Thank you.
Thank you. Representative Paul, don't walk away. Come on. Representative Grant.
Thank you, Mr. Chair. Thank you, sir. So you serve people with developmental disabilities.
We do, children.
Children. And under Section 28, the funds are going to be reduced. And do you have a wait list already for your services? And how many people, how many children are we talking about here that you think will be impacted through your organization as a result of this cut?
The answer to your first question is yes, we have waiting lists for virtually all of our services, and that includes all of our Section 65 services and 28 services. There are waiting lists for that. We just opened 5 months ago this site in Skowhegan, We have 26 kids with autism that we're providing services to, center-based and in-home services. And I believe that at least 1/3 of those children that are getting in-home services through that site would not be able to receive those services any longer. Financially, we just couldn't sustain the services.
Is that the case? Thank you, Mr. Chairman. Jeff, nice to see you again.
You as well.
Thanks for all the great work you do. I just was a little confused by your next to last paragraph here. You were reading it wrong. I thought it said that even with current rates, you've had to cut out the going to folks' homes?
That's right. Right. For us, there are two places in Section 28 that we provide services. One is what's called 28 basic services, and the other is 28 specialized. 28 specialized was created specifically for kids with autism, and 28 basic is kind of a catch-all for other kids that have developmental disabilities, delays, and behavioral problems. And the rates are very different. The 28 basic rates for a behavioral health professional that's going into a home is $35.76. And so, and the rate for specialized services is significantly more than that. It's about $57 an hour. So we've cut back on our basic services. These are not our autistic kids. These are kids who might have an intellectual disability and have anger management problems and acting out problems. Those services, we had to cut them back to only kids that were getting center-based services.
Representative Sandoval.
Thank you, Mr. Chair. Can you tell us, with these cuts, I mean, I know it's always kind of like a balloon, and if you squeeze the balloon here, the costs are going to pop out somewhere else. Can you share more? I think we got a picture yesterday more of adults where those costs will pop out, but where we'll be paying more in the long run if we make these cuts?
Sure. What I can tell you about the research, and we've done a lot of research review, or as much as was available to us, in conjunction with the Autism Institute at the University of Maine at Orono and with Child Development Services here as part of the Department of Education. And what we've learned through the research, and what Deborah Rooks-Ellis, who's the director of the Autism Institute, kind of spearheaded for us, was that, in her estimation, there is a 10-fold increase in dollars that are required for children that do not get an early intervention specific to autism. So that from, say, 6 weeks to 21 years of age, her numbers are 10 to 1, and I've seen other research studies that say anywhere from $7 to $14 for one. So, and then there's this study that just came out that Mayor Rogers did out of University of California that cites that 40%, which is a model that we can't replicate, this research model, but we can come close, and we have a plan with the Department of Education and with Maine Care at this point paying for the service to come close to replicating this model that has certain types of kids with a profile of autism. 40% of these kids, as I mentioned, falling off the spectrum, and that's an enormously intriguing outcome. And when we think about what children need, it's just like a typically developing child. When you think of them from 2 to 5, right, they're learning how to talk, or learning how to process auditory information and visual information, and assimilate that information and engage socially with their peers and with adults and with their parents. Those neurotransmitter paths are developing in normal kids, and they're trying to develop in kids, you know, that have autism and other types of intellectual delays or disabilities. So that once a child, and again, research supports this, once a child gets to be 8, 9, 10, 11, that window has come down. It doesn't ever shut completely, but there is definitely a window of opportunity for children that are 18 months to 6 years old that does not exist at any other time in our lifetimes as we develop in terms of brain development, to make the kind of gains that they can make from 18 months to 6 years old. And that's why it's so important that this early intervention happens, particularly for children that have the disabilities like we see every day.
Follow.
Just one quick follow-up. It's hard for those of us who haven't had to experience this to think about what it must be like to be a parent having to cope with this kind of diagnosis for their child. If you could describe just one case of a family that, you know, the main care benefits manual describes, you know, what Section 28 is, but tell me what that is in human terms for the typical family that you serve.
Sure. Okay, I will describe to you a particular child that we have now. He's 3.5 years old. He was referred to us by a pediatrician who saw developmental delays and a lack of social engagement that was age appropriate. And so they've got referred to Child Development Services, and Child Development Services subsequently referred that child to us. And so through the Edmund Urban Center in Waterville, there was an evaluation that was done with the diagnosis of autism. That child is in our center now, also receiving a small amount of in-home family supports. And what we try to do through this applied behavioral analysis technique of intervention is to have a child who right now is nonverbal, who screeches and flaps and tantrums, does not make eye contact, does not engage in a joint attention with an adult or with a peer, has no play skills, and has a hypersensitivity to light and to tactile stimulation, to touch, physical touch. So that means that these parents are, or in this particular case, this single mom, is parenting a child that she can't hug, that she can't talk to, that she can't read to, that she can't pick up and comfort. And then actually there's a paradoxical effect in that when her child is upset and uncomfortable and crying and distressed and perhaps screaming, our natural reaction with our children is to pick them up and comfort them and console them, and it has the opposite effect. It creates more discomfort, more screaming, more tantruming. And so our job, through a very thoughtful, evidence-based applied behavioral analysis technique, is to change the behaviors around the emotional kind of dysregulation and tantruming, and there are specific things, interventions that we do with children that help them create a joint attention between another, make eye contact, either sign or verbalize or use symbols to talk about what their needs are, and to help parents provide structure in their homes so that they understand the triggers that can set a child off like that. Because for this particular child, like many children that are autism, sensory overload comes very quickly. And so to create an environment where the sensory experiences are minimized and the environment is more supportive of the way they experience the world can help enormously. And applied behavioral analysis techniques oftentimes are counterintuitive to what we as parents want to do with our children. And so it's really important that this in-home piece happen in the natural environment, in the home environment, that we can help parents, educate them around how we view their child, and hear the information from the parents, and actually see how those children are experiencing their home life as a means to help guide the process for more social engagement and less disruptive behavior and emotions.
One more.
I just want to thank you for that, because it's put a human face on this situation that we're being asked to really make some difficult choices between some very vulnerable populations, and it's important for us to see what that means in human terms. So thank you for the very clear and articulate description.
Sure, you're very welcome.
Representative Burstein.
Thank you, Senator. Good afternoon. Do you have a hard time finding workers to do these home visits? Because it seems like you have to have a certain kind of education to be able to deal with this.
We do. Main care requires college credits and a fair amount of training, and which is all a good thing, but we're underfunded so that we can't find people or have a difficult time retaining staff to do this work, because it's hard work, as you can imagine, going into somebody's home, working with children like this. So yeah, our frontline positions start at $8.50 for basic 28 services. And our specialized in-home services, folks that have been through our Early Start Denver Model ABA initiative, we start those folks at $12 an hour.
Thank you.
Thank you, Jim.
Sure. Thank you.
Sandra?
Good afternoon. Please begin.
Good afternoon.
Great to have you here.
Thank you. Thank you, Senators Hamper, Brakely, Representative Rotundo, and members of the Joint Standing Committees on Appropriations and Health and Human Services. My name is Sandra Fridge. I'm a board-certified child and adolescent psychiatrist, and my understanding is that you have heard at least 4, if not 5 other child and adolescent psychiatrists testify in the last 24 hours. Which is a fairly rare event for a child psychiatrist to get out and talk in public, and there aren't that many of us. So you've seen roughly more than 1/10 of the practicing child psychiatrists in the state of Maine testifying, and I think that shows how much we care about this budget process that's going on. I also trained in pediatrics, so I can speak to a little bit the pediatric side of things as well. I'm here to speak and oppose the DHHS budget initiative for realigning payment for medication management, but also Section 65 and Section 28. I know that my colleagues before me have spoken eloquently about the impact that would have on practicing in many different settings since then. However, I do want to applaud and commend the efforts in the budget to maintain or enhance main care payments into primary care. I think that that's absolutely essential, but that should not occur at the expense of other providers. I would challenge each and every one of you up here to spend a day in a primary care office. Until you spend a day in a primary care office, I don't think you'll begin to appreciate what this budget is asking primary care providers to do above and beyond what they're already doing. I'm also greatly concerned about workforce shortage issues, not just in child and adolescent psychiatry, which I know you've heard about, but also in the primary care setting. By asking people to do more, the chance for recruitment and retention is going down. So I'm concerned, how are we going to take care of people in the state of Maine without adequate supports for them? I'm also concerned that in my trying to look through Maine.gov, and DHHS, I can't find a recognized strategic plan looking at mental health, prevention, bridging together the needs for families along with kids, along with the adults with persistent mental illness, that a strategic plan could have guided the budgetary process, but I don't see one. And I do believe there's places to make cuts in the budget, but without a strategic plan saying, what are we trying to achieve and how are we going to go after that, it's hard for me to have an understanding of where these budget cuts are making sense. I'm also concerned, especially with someone who spoke before me, that some of the best evidence-based mental health treatments and behavioral health treatments and prevention models have all been grant funded and there's no sustainability. Rather than take an approach from the state saying, we are going to ensure that every child in the state of Maine has the most optimal chance to be successful, to graduate from high school, to not end up in the juvenile justice system and become a working adult. That's not present at present time. I'm also concerned that some of the things I've heard and read, that the budget is asking primary care professionals to work out of their scope of practice without adequate training. As a board-certified child and adolescent psychiatrist, I work with the pediatric providers. There's limited mental health training in pediatric residency. There's limited pediatric mental health training or mental health training in general for family medicine. And there's almost no, you have to have availability of psychiatry services for training in internal medicine, but no requirement to learn about that. And yet, it looks like the budget is trying to divert all that into those primary care specialists. I do also come to you as the physician leader of a program called the Child Psychiatry Access Program, where we work with pediatricians in the community and we provide education, telephone consultation, and help guide their treatment in primary care. Models like this exist throughout the country. In many states, they're state funded, and they help our primary care providers to do the work that we're actually asking them to do and support them in the work that they're doing. So I think there are models available to shift some work towards primary care, but we need to pay attention to finding ways to make those happen as well. I want to thank you for the time listening to me and reading my testimony. I know you guys have a lot ahead of you, and thank you very much.
Thank you. Representative Grant?
This is a quick one. On page 5, you have a map, and
Yes.
it's in black and white, and I know color copying is expensive, but it's really hard to differentiate between the none category and the 0. Your point is pretty easily taken, that vast swaths of Maine have 0 to 2
Right.
child
At
psychiatrists.
any given time, on any given day, there's at least 6 to 8 counties in the state of Maine where there's no child molesting psychiatrist available.
Thank you. Because it's probably unlikely that we'll all take a trip to a primary care office, could you give us a little demonstration, verbal demonstration of what we would see if we were there in terms of the day of a primary care physician if they had mental health service integrated in the way that this is predicting?
So I'll speak to 2 different aspects of that. So there are mental health integration services that happen throughout the state. Those were originally started through grants through MHAP, Maine Health Access Foundation, and where there may be an LCSW or a psychologist